Hi everyone, week 4. I'm still in the game. This session, I've been having some serious time management issues and I should be in bed right now. It's between work, school, family, and my little side hustle of like Zumba instructing at night. I feel like one of those people that spins plates, but I'm still forging ahead. I'm almost there. I'm in the home stretch and I'm trying to finish this degree strong. So, this week, um, I don't know, I was thinking that throughout my life, I've had a few different experiences and dealings with doctors that possibly have like impacted me both in negative and positive ways. It's kind of funny. I was trying to reflect because first, I don't really remember much of my childhood experiences with doctors. Although I had a lot of stomach and asthma problems, and even though my interactions at the time, I don't remember like any of them making a significant impact on me at all, like positive or negative. Um, yeah, I have a weird recollection of like a doctor in my early teens, like asking inappropriate sexual questions, and I remember kind of complaining to my mother, but then he was removed from that practice and I never saw him again. So um, probably for obvious reasons. Later on, when my children got older, or actually when I go through the OB, the OB that GYN that I went to, you had to try out all the different doctors, and I really actually got along with all of them. They were all very nice in the practice, and at the maternity ward that I delivered in, everybody, all the nurses were very, very nice. Had all my children at that hospital. It's been more recently changed in the OB because a larger hospital bought out the small community hospital for the town that I live in. And so it's been a lot of changes. I don't know where I'd have them now because I actually work in another non-for-profit hospital now that is a little bit further away from my house. It's a smaller nonprofit hospital. Um, it doesn't have a good reputation in the community for like customer service and stuff, but they've been really trying to change that around. And I got hired actually, a year ago. I started off in the lab, and now I actually work for the Family Advocacy Center still with the hospital though, because they really said that any of the people they've been more recently hiring had seemed to have a cheerful disposition, had a background in customer service. So you could tell that they've been trying to change that image of themselves, which is really great. Um, which brings me to think about, we have a lot of stuff this week that we're reading about like patient practitioner relations. Um, and I also think it's important, and there was a part about staff relations, which I think is really important because, especially working in a hospital, sometimes, like when I was in the lab, sometimes if the lab coworkers weren't getting along, you could feel the tension, and they're trying to keep a, a patient calm, but you could feel the tension between the two employees. One great thing that we do have at the hospital, we're trained in something called AIDIT, and it's a way that healthcare professionals, because I don't think it necessarily has to be only the doctors that have to have a good size manner. It has to be the patient care, the people at registration, the phlebotomists, the nurses, people in billing. All of those people um, contribute to the whole patient's experience and what they're going to take back. And I actually remembered when my children were young, I was going to a pediatrician, and by the time I had my third child, she was a baby and she was sick. And I called up the doctor, and she was really sick. And he's like, "Oh, yeah, bring her in." Well, I brought her in, and it was the receptionist lunchtime, whatever. And she was talking about me behind the window, that she couldn't believe that, you know, I had to be seen, blah, blah, all this stuff. So I ended up leaving that practice and I ended up finding, and that was when my daughter, she's now 18. So that was when she was first born. And I was just really, I ended up like, I remember like knocking on the window and I'm like, I can hear you. So I ended up leaving that practice despite the fact that I really liked that pediatrician. And I did run into him in the community later on. And I told him that probably should get a hold of his staff a little bit better, because it had been more than one time that the reception, and the medical assistants were very rude. So that's one thing to remember. So going back to AID-IT, which is a type of framework, the way that healthcare professionals communicate with the patients to try to decrease their anxiety, and it improves clinical outcomes. So it's an acronym AIDET. So A is acknowledge, and you try to greet the patient, you make eye contact, you smile. The thing they always try to tell us, if you're walking down the hall and a patient looks lost, try to really direct them to someone that can help them. And even if you have, you're late going somewhere or you need to clock out, like you really try to do that. Um, I is introduce yourself. So you say, hi, I'm so and so. This is where I work. So you can, really, or you tell them your level of expertise. So where I am now, I'd be like, hi, I'm Michelle Lucraft. I'm a family support provider, work in the Family Advocacy Center. So that's how, I would do that now. Before it would have been that I was a lab technician. So duration. So a lot of times, people get really upset when they're at a hospital or a doctor setting about time frame. If you're like, oh, you're next, or right, you sometimes it's good to give specifics. So if there's like a few people, like I know in the blood lab, if there was a few people in there, you'd say, well, um, it's going to be about 15 minutes or a little longer. So they have an expectation and they understand that. And it's good for you to kind of know the timing. But of course, anything could happen. An explanation, step by step what they can expect, after they register, what they what they might need. Um, and then T, of course, is thank you. And you always express your gratitude to them. And this AID-IT is, if you follow it, you can see that the patients really enjoy it. And even if their experience maybe is not good or they're not feeling very well, you you can see, and I especially saw I got to know like a lot of the oncology patients when I was working in the lab, and you can tell just if you kept with that, you really actually got to know them. And some people even came in really grumpy, but ended up in a better mood. So I don't know. I think those things are really important. I like, all the cultural diversity that I have at my hospital. They're trying. We don't serve a lot of cultural patients, and the other thing is, language communication. Um, I speak only a tiny bit of Spanish, but that they're trying to, I can tell they're trying to diversify the hospital I work at, but the area is mainly a lot of white people, but we have gotten a few people that spoke Arabic, but we have, the hospital has a screen that you can call in, and it translates. And the cool thing, and I forget what it's called, we call it like some kind of name, but the cool thing is you actually can't talk to the screen even though that person's speaking your language. You actually still have to speak to directly to the person, and then the person on the screen translates it to them. So it's pretty cool that, we can use technology in that way to make things, a little bit more experience for people. And it will, if they're having a better positive experience, it will aid in, better healing. So that's all I have to say for today. Have a great night, and we're almost there.